Hello everyone, welcome to Dental Heart. In this video, we are going to read about the spread of oral infection. Interaction. It is the interaction between the host, environment, and the organism. Now we will study how this lesion spread. Oral infection originates from the pulp, means the first infection happens in pulp, then it reaches the root canal, then after getting inside the root canal it goes to periapical tissue, the tissues towards the tooth, the both side of tooths, then perforated bone. As we know that after the periodontal tissues and ligaments we have our alveolar bone, so the infection reaches up to the perforated bone area, then this spread where goes into various tissue spaces. It also reaches into the mucous membrane. Let me show you with a diagram. So you can see it is a tooth structure, and we are having pulp. This is our pulp. We have our root canals here. These are the root pulp horn. These are the root canals. So as you can see here, it is written oral infection originates from the pulp. The infection occurred at the pulp, then it goes into root canal. This is the root canal. We know that these are binded with the periodontal tissues. So this is the periodontal tissue, and we see the perforated bones are there, na? Bones, alveolar processes are there, sockets are there, na, on which other tooths are also present. So these are the perforated bone, and after that we have gingiva, oral mucous membrane. We have many other soft tissue as well. On that, this infection got spread. So we are going to see what happens next. Wait. Okay. Various routes of spread. Various route of spread means how our infection got spread to the soft tissues because of the lymphatic drainage, bloodstream, and directly through the tissue. Means one tissue is infected and it infected the other tissue side by side. Okay. Then infection causes changes in the local and systemic, means the infection happened, get converted into local infection, then systemic infection. In local infection we have pain, wait, we have pain, swelling, restriction in movement, pus formation. The very important line is here is the pus formation. The pus formation happens in the local changes when occur, na, then pus formation takes place. Systemic: fever, lymphadenopathy, malacia, and increase in blood count takes place. The next is the main heading, or the main topic on which the today's lecture is cellulitis. What is cellulitis? Its definition is very important. It is frequently asked in the viva. Diffuse inflammation of the soft tissue, and it is not circumscribed, not localized in one area, tends to spread along tissue spaces. When it get one spaces, then get another spaces, it goes to spread from here to there. Its causes, it having a two basic cause which is also very much asked in viva: sequelae of apical abscess, osteomyelitis, periodontal infection, and infection following tooth extraction. Means when we are extracting any tooth and we have not cleared the excess material, and we have not polished the bone, the sharpness of the bone, then this infection may happen because of the food lodging as well, or because of the injection, needle prick injury, and on that area, if that area is infected, the infection may cause the cellulitis. Next, clinical feature: how the cellulitis will look, how the cellulitis will feel to a patient is that diffuse painful swelling. It is a very painful condition which is having a swelling in it. overlying skin. How the skin will look? It will look inflamed. Oh, and it have a orange peel like appearance. Orange peel like appearance is a very important point here. And it have regional lymphadenitis, means the lymph nodes and the lymph drainage which are there on that area where the cellulitis had happened, their drainage system, their drainage property gets stuck. Then the cellulitis is of two types, initial types and final types. So here we will see diffuse redness, soft to hard swelling that is tender to palpation. When you will get a patient of cellulitis having a cellulitis and palpate the swelling area, you will feel that the swelling is soft, or it may be soft to harder in nature. In inflammatory response not yet forming a true abscess. There is no formation of abscess, and yes, this is the basic difference between the initial cellulitis and the final cellulitis. The initial cellulitis is a red, soft to hard swelling without any abscess, and the final cellulitis is the cellulitis which is having a abscess. Okay, it is having a true abscess, but the initial cellulitis does not have any abscess. True abscess formation, as I mentioned, initial have no abscess, final have abscess, and it have which type of abscess? It has a true abscess formation. Then infection localized abscess formed. When this happens, suppurative material presents 6-point discharge upon a free surface. Discharge takes place. Then what we see in histopathology, in histopath slide we will see neutrophil. In the connective tissue we see the lymphocytes, collagen fibers, and the muscle fiber as well. And what is the treatment of cellulitis? Antibiotics plus anti anaerobics removal of cause of infection. To prevent solidification of abscess, we should advise not to massage the affected area with any medication. Means, listen, it means that if we see an inflamed area, we used to tell na take this cream and massage over it. It will be helpful to reduce the inflammation. No, we should not advise a patient having cellulitis to massage their inflamed area. It is not advisable. We should give an antibiotics and an anti anaerobic to the patient. That's it. This is all about the cellulitis. Hope you like the video. If you like the video, please like, share, and comment. Thank you.